had a lot of people ask me about my cancer story. Um, so basically, I'm just gonna explain everything from the beginning on how it happened, everything like that. So, about 3 years ago, I went into surgery for a fully torn patellar tendon in my left knee. That wasn't even what was bothering me the most. I had a lot of pain on the side of my knee. Nothing showed up on the MRI, anything like that. Um, so my doctor was like, "Oh, maybe it's a meniscus tear." So he goes in arthroscopically. He repairs my tendon. He checks the side. Said there was nothing there. He scraped my meniscus, scraped some scar tissue off the meniscus, and that was it. So while I was recovering, going through physical therapy and everything, that pain was still there. And he just claimed, "Oh, just wait, it'll be okay. Everything's gonna be fine. There's nothing there. You're just recovering from us scraping it." Sure enough, I just listened to him. I let it go, um, and it was still there. It didn't go away. It was so bad. I couldn't run. A lot of you know this. You saw me struggle trying to run. I couldn't fully go down squatting without pain. I can't contract my hamstring. A lot of things like that. Um, so that went on for about 2 years, maybe a year and a half, 2 years. And then I finally went back. I got another MRI because I was like, something's wrong. Something is wrong. So I got that other MRI. We got a nerve test done. I went to a neurologist because we thought, oh, maybe there's something wrong with my nerves because my leg was twitching, my leg was spazzing, it hurt all the time. I had pulsing pains, pinching pains, stabbing pains, all that good stuff, and we didn't know why. So we did a neurology test on my birthday. Got the results back from the MRI, and there's something about, I don't know, that big. Showed up on the MRI. My doctor said, "Oh, it's just a Baker cyst, nothing to worry about. And if you don't want to get surgery, you can just leave it alone, and we'll watch it." Okay. Naturally, I don't want to have another surgery. I had already started getting ready for bodybuilding shows. My first show, the March 12th one, and so I was like, "Well, I'll leave it. It's been here 2 years. What the hell? There's no big deal." And the doctor didn't think it was a big deal either. We left it. I was still in a lot of pain. I went through my entire first prep with a lot of pain. My coach knows I was very limited on legs. So, I did what I could, but it was very limited. And that, you know, the biggest thing for me is my legs couldn't be the same size because I couldn't feel and squeeze the entire outside of my leg from the hip down to my ankle. I couldn't work the lateral part, so that limited me a lot. Anyways, I did my first show, and then when I was getting ready for the next show, probably around, I think it was the end of April, beginning of May, somewhere around that time, I was squatting and I saw a bulge out of my leg, big bulge. And I was like, "Oh, that can't be good." So we went, got the MRI done. Um, it had grown 4 times its size um, from that last August, so it hadn't even been a full year, and it really, really grew. So I continued the prep. I finished my show, and I invested money into it already. I invested time into it. I wanted to finish. So finished my show. Um, July 23rd. July 25th, I went in for a needle biopsy. They get the results back. They say nothing to worry about. It's just a cyst. They drained 19 cc's of blood from it. So if you guys know what that is, yeah, it's about a milliliter per cc. So 19 from my tumor, which at the time we didn't know was a tumor. So, they said the results were inconclusive. So my surgeon, decided to do an open surgery biopsy, in which, if there was nothing suspicious, he would completely remove the tumor, or cyst, or whatever at the time. So he cut me open. Obviously, I was knocked out. I'm under the impression that I'm going to wake up and the thing's going to be gone. My pain's going to be over. I'll have a 2-week recovery as I was told, and I'll be good to go. Well, sure enough, I wake up thinking the tumor's out. I'm all happy, and dude comes around the corner, tells me, nope, we didn't take it out, we sealed you back up. And so, obviously, at this point, my mind is just like, oh, shit. We had already met with an oncologist, so that was a little suspicious for me anyways. And so I just kind of had that gut feeling that it wasn't just a cyst anymore. It had been misdiagnosed so many times, and I was told it wasn't a big deal, but no one could figure out how to fix it. So I was a little worried. They say they're going to call us in 3 days after the open surgery biopsy to schedule another surgery to remove it, because they were going to get the results from the pathology. Well, we got that call August 19th. They told me I had been diagnosed with cancer, synovial sarcoma, very rare, one of the rarest soft tissue cancers in the world. 1 in a million people get it. It's generally a genetic thing, is what they said. There's not a lot of research on it. There's not a lot of ways to treat it. There's not a lot of research on the treatments, and so, we're told that, chemotherapy might not help. Oh, this and that. So we're not going to do chemo. So we're like, okay. So we're getting ready for radiation. We get me mapped. Sure enough, right after that, we got another MRI, and the thing was, according to them, 16 centimeters. Basically, what happened is it's a tumor, and it has a cyst of blood attached to it. So they thought it was a benign hemorrhaging tumor until they found out it was cancerous. So we were told it was not cancer all the way up until August 19th this year. It took them about 3 years to figure out that it was cancer. Luckily, it didn't spread anywhere. I have a very aggressive cancer, and usually it spreads, and once it spreads, you're kind of screwed. But I ended up having 70-30 odds. 70% live, 30% die, so handled that. And then we were bounced around on plans. So it went from, radiation, no chemo, to, we're going to do chemo and radiation at the same time. Then it went to chemo and then radiation, and then more chemo after surgery, and this and that. And honestly, it's still bouncing around. We still don't really know. But I have gone through chemo. I was doing 3 days in a row, 8 hours a day of chemotherapy. The highest dose that they can give me, doxorubicin and ifosfamide were the 2 primary drugs that they were giving me. And it was fucking miserable. God, you don't want to move when you're on chemo. Your entire body feels weak. You're sensitive to light. People talking to you hear what they're saying, but you can't really process what's being said. You're basically brain dead. The entire time you feel completely useless. And you can't eat. I didn't eat for 18 hours, like every day, because I couldn't do it. And, when I would eat, I would throw it up. There was just nothing I could freaking do. And, I went through all that. Obviously, I lost my hair. My eyebrows are thinning. I'm not growing any facial hair. And I still was getting in the gym. I didn't find an excuse to get out. I mean, while I was going through chemo, I was in there about 4 or 5 times a week. Doing the best I could, eating the most I could, and honestly, I didn't lose any weight. Surprisingly, most people lose a lot of weight. I ended up gaining 6 pounds on chemo. Chemo finished up, I started radiation. I'm still going through radiation right now. I'm actually coming up to my last week. My last day is December 15th of radiation. Radiation kind of sucks. I mean, it's really just, you're tired. And that's kind of it. I mean, my tumor started hurting a lot more. It got really swollen because it inflames it from the radiation. And my skin is actually pretty jacked up. It got a pretty gnarly burn on it from the radiation. Totally normal. And it's just raw, But, this is one of those things where I kind of learned now the doctors don't know everything. So if you have something you're concerned about and you truly feel that there's something wrong, get it really looked at, because you know, at the time I was young. I was 18, 19, going through that shit. And I was just like, well, you know, doctor's saying it's not a big deal. There's nothing there. I guess there's really nothing there. Um, but, you know, I've got a surgery coming up in about, I don't know, like a month. Probably a month from now. But right around January 10th is when that's going to be. And, yeah, you know, I mean, there's going to be complications with the surgery, potential complications. There's a chance they have to cut all my ligaments and do a completely reconstructive surgery to my ligaments. There is a chance that I can lose control over my foot to where I'll have a foot drop because they have to move a nerve out of the way. I mean, this tumor is pressing on two nerves. It's right up against my vessels. There's a lot of things that can happen. I'm basically being told that I'm for sure going to have an infection, just because when you go through chemo and radiation, it doubles your chance of risk of infection. So there's a lot going on. In my opinion, I'm through the hardest part. I made it. You know, still been working out, doing my thing, doing everything I can, staying positive. I mean, at least I don't look horrible bald. I mean, I miss my hair and everything, but you know, it is what it is. And really, I'm not looking for people to pity me, feel sorry for me, anything like that. I really want people to understand that this is very important. Life is important. And you need to realize that if you have a little thing, like what I had, what I thought was a little thing, not a big deal. That's the most important thing is get it looked at. Be sure about it. Because you really never know. And that's really what I want to get across in this, and just because, you know, no one deserves to go through the shit that I've been going through. You know, it's just, it's not fair to me. It's not fair to the people around me who are very close to me who see it. And I just want to make sure that no one else makes that kind of mistake. I'm not blaming anybody. It's not necessarily anybody's fault. But, you know, again, like I said, when you're told everything's wrong and you have that kind of mindset, you just kind of keep going. So that's basically the story. I mean, everyone's been asking me, and I've had to tell this 100 freaking times. I probably left out some details, but for the most part, I got it through. A lot of misdiagnosis. It's been a pretty rough few months since I've been diagnosed. I mean, nothing's really been the same. And it is what it is. But, you know what? You just get up every day and you get through it, you know? So, it is definitely been a crazy 3 months. Well, almost 4 now. But anyways, that's all.